is Silverton Television. To my viewers, today we are in Komarok. It is my pleasure to me to be here in Komarok today. For the viewers, if you want to follow us live in our Facebook page, follow us through 0741 280 262 or 0731 225 738 if you want to follow us. Now, today I'm a privilege to interact with our doctor here. And our doctor here, we want to know you here.
Hello viewers, my name is Dr. Noah Senso. I'm a medical doctor. It's a pleasure you guys to come to our facility. Welcome and feel at home.
Right, thank you, Dr. Noah. Now, and who is Dr. Noah?
Dr. Noah is a medical doctor in our facility, Equals Medical Center, whereby I'm a consultant in obs and gyne cases.
Right. Today we have a very important discussion here with Dr. Noah, and he will explain more about what he wants to tell us today in our Eagle Mission Hospital.
Today we have decided to come up with to depict some of the common conditions in our facility, whereby we have realized that our facility is located in local and socio-economical status, and we have decided to come up with some of the common conditions in our girls and women. Okay. Today we are going to talk about abnormal vaginal discharge. And when we talk about abnormal vaginal discharge, these are the discharge which in one way or another they make our girls, women and girls to be more uncomfortable. Okay? And before that, we must realize or understand the difference between the normal discharge and abnormal discharge. Okay? Every woman, that I'm talking about the normal women, they have got what we call the glands in their genital part. These glands are in the vaginal tract. They are located in the vaginal tract. They are also located in the cervical region, and others, they are located in the uterus. Now, this gland, their function is actually to secrete some fluids, constant fluid discharge, which normally comes out periodically. Now, somebody might want to ask me, what are the function of these fluids? We will find that the function of these fluids is to eliminate the debris, the dead material, all along from the uterus downwards. Okay? Now, once these fluids have been discharged, their main function to remove this fluid is actually to clean and to make this genital tract to be healthy and protective. Okay? Now, if a woman comes to me as a doctor, will come and complain that I have got abnormal discharge. Now, this abnormal discharge, I would like to know the character of this particular discharge she's talking about. Some of the abnormal character, you'll find that this discharge, in one way or another, it's itching. Some discharge, they are colorless or red or green. You see? Now, you'll find that once I've depicted that particular abnormality, I'll be in a position of handling that particular situation. Now, having understand that there are, as I've said, there are discharge which are itching, others they are burning in sensation. There are others who are actually very discomfort that the woman cannot tolerate. Others, as they experience such particular discharge, even the partner, that is the husband, will in one way or another complain. Now, as a doctor, you must save this particular family out of these particular diseases, because there are others who think that each and every discharge, it's a sexual transmitted infection, of which it's not. Now, there are other diseases which affect the genital tract. There are others who affect the cervical region. There are others who ascend and affect the uterus. There are others from the uterus, they even ascend to the fallopian tube and even the water, the ovaries. And that is a situation whereby you'll find some women even complain of infertility. Okay? Now, the diseases which are commonly affecting the vaginal tract, we call them, okay, they are grouped into some pattern in a way that you'll find that the ones that affect the vaginal tract, we call them vaginitis.
Vaginitis.
Yes. Vaginitis in the sense that they cause inflammation into the genital tract. There are others which commonly affect the cervix. And since they cause the inflammation of the cervix, we call them cervicitis. Okay? There are others which ascend and even affect the uterus. And they cause the inflammation of the uterus. And such condition, we call them endometritis. There are others which affect even the fallopian tube. The fallopian tube, that is the communication between the ovary and the uterus. And such a condition is known as salpingitis. Salpingitis. Those are big names, but I just want to make you understand that these are some of the parts which are being affected. Okay. Now we have common organism which affect this part. Now, since they are affecting the vaginal part, the most common organism is bacterial vaginitis, from the word vagina. Okay? Now, after they have invested there is one of the most important issue to note. The condition or the environment of the vagina is acidic in nature. Okay? Now, why acidic in nature? The acidic in nature in the sense that they kill, if there is, in case there is a microorganism which is trying to enter into that particular tract, that is the vagina, it will not survive because of the acidity. Now, there are microorganisms which are good, which are living in that particular part. And the name of that microorganism is one known as lactobacillus. Now, the function of lactobacillus is actually to excrete the lactic acid. You will remember the lactic acid is a weak acid. Now, that particular acid is going to make some havoc into the growth of the microorganism. Now, okay, having understand that, another organism which affects the vaginal tract is known as the Candida. In a normal language, we call them the fungal. The fungus. Others say fungus, but it's the fungal infection. But the scientific name is the Candida. Now, since it's affecting the vaginal part, we call them vaginal candidiasis. Okay? Now, there is another bacteria. I'm talking about the common causes. Then we'll discuss each and every one at a time. Now, there is another common bacteria, or rather an organism, which cause a lot of problem. We call it trichomoniasis, the trichomonas. Now, you see this particular thing, this particular organism, the woman will come and tell you specific symptoms. That you see, daktari, I have got a green discharge and intense itching. As a good daktari, you will understand now that this is trichomoniasis. Okay? Now, trichomoniasis is a sexual transmitted infection. If it happens that a woman is suffering from such particular disease, in one way or another, she might affect the husband. But bacterial vaginosis is not a sexual transmitted infection. It does not transmit to the partner. Okay? Now, since it's an environment which is changing, that is the bacterial vaginosis, but this one, the woman will acquire through sexual intercourse. Have you seen that? Now, there are other diseases which are affecting the cervix. The one which are affecting the cervix, you will see now, this woman is coming to you, you must now open the cervix with a speculum. A speculum.
So before we go to speculum, we want to take a break. That side that will come after a short period of time. Remember, this is a Silverton television whereby we are discussing on how disease can be treatable, concerning more on ladies.
Unaambiwa kwamba ukitaka kujua samaki wanapatikana katika mkondo gani, basi jiunge na wavuvi waliogobea. Nami nakwambia pindi unapojua basi fuatilia, na hatimaye utarudi bandarini na mzigo wa mafanikio. Silverton Media Management Broadcast ni kampuni inayoendesha harakati kama vile music production, video production, music school, computer course, school of journalism, school of video and music production, event organizing, music recording, film classes, script writing, film directing, vile kufanya kisawa katika shughuli za online marketing, advertisement of items and properties. Usichelewe, maana muda ni sasa. Unaweza kuwasiliana nasi kupitia nambari za simu 0741280262 ama 0731225738, ama unaweza kuwasiliana nasi kupitia email silvertonmediamanagement@gmail.com. Tunapatikana Facebook kama Silverton TV, YouTube Silverton TV, ama Silverton Radio. Silverton TV, changing life to be lively.
Right, welcome back again. This is Silverton Television, where we want to know how people could live. Remember that earlier I introduced by saying by how people live, how people will live well. And right now here I am with Dr. Noah, where now he can explain more. Remember that, ladies, this is privilege to you. SMS us through 0741 280 262 or 0731 225 738, where we will read your question and Dr. will answer. Back to you, Dr.
Okay, thank you very much. Now we have discussed a lot about the vaginal tract. I think now if there is a question we'll pause, then I'll answer it after the end of this topic. Now we are in the cervix. The cervix is actually a wall that differentiates or that divides the vaginal tract with the uterus. Others they call a door, because it's a door which you know, they separate the uterus, the uterus and the vagina. Okay. Now, I've said that there are other diseases which affect that door by the name the cervix. Now, that cervix, once it has been affected, you can't see it from outside. You must use some other instrument by the name a speculum to visualize it. Okay? Now, there are some of the things that you'll be in a position of looking at them so that you can differentiate between the bacterial vaginitis with the cervicitis now. Now, if you put the cervix, if you insert the speculum, you'll be able to visualize the cervix. Now, there are some of the things that you will come up with. There are other cervix which they are actually with the change of color. Have you seen that? There is change of color. Actually, that particular cervix is a diseased. Now let us differentiate the healthy cervix from unhealthy cervix. Now, if you visualize that particular cervix, the one which is healthy, there are no erosions, there are no bleeding or change in color. That one is a very normal cervix. And if there is a discharge, you will realize that now that one is a bacterial vaginitis or other things apart from the cervicitis we are talking about. Now, if you realize that after inserting your speculum, you realize that there is some erosion in the cervix, there is some ongoing bleeding, there is discharge which is coming from the internal os, your first diagnosis will be cervicitis due to some of these organisms. Now, what are some of these organisms which are commonly affecting the cervix? One of the common organisms is chlamydia. Chlamydia, it's one of the commonest organism which affect the cervix. Another organism which affects the cervix is gonorrhea. Okay, so it affects this cervix in a very large way, and both of these infection, they are sexually transmitted infection. Okay, having understand that, now we are moving from the cervix to the uterus. There are diseases which penetrate through the cervix to enter into the uterus. And if you remember, this kind of a condition is known as endometritis, the inflammation of the lining of the uterus. Now, this patient will come to you complaining of the abdomen. Have you seen that? Now, if this patient is complaining of the low abdominal pain, and if you open, you see there is some discharge which is coming from the internal os, automatically you're going to make some diagnosis and do some other further investigation. Okay? Now, before I go on, we were discussing about the candidiasis. I want to remind my viewers that candidiasis, once you've been diagnosed with candidiasis, most of these patients will find that their immunity have been compromised in one way or another. Okay? Think of HIV patient. Those are the patients which are commonly affected by candidiasis. Think of those people who normally use a lot of antibiotic because they tend to reduce the immunity. So once the immunity have been compromised in one way or another, this particular patient is going to contract vaginal candidiasis. Okay?
If I may ask that,
Yes.
talk of gonorrhea.
Okay.
And what about syphilis? Will it be categorized as a disease again?
Yeah, you know, syphilis is a sexual transmitted infection of each cause, but we were trying to depict some of the common conditions which affect this particular part of the genital tract disease. Have you seen that? When the syphilis is there, it's a sexual transmitted infection, but it's not a common disease nowadays. Although it's there, but it's not a common.
It is not as serious.
Yeah, it's not as okay. It's serious once you've contracted the disease. It's a serious disease, but it's not common. Okay. Now let us understand how do we make some of the investigation that we are supposed now to make for you to depict this particular infection. This woman, once she has come to your facility, we are going to take the sample of the discharge. Then we put it in the microscope. Then we'll be in a position of differentiating now some of this organism. If it's bacterial vaginosis, we are going to do even the urinalysis. Have you seen that? Once we have done the urinalysis, now we'll be able to differentiate properly that this one is bacterial vaginosis, this one is candidiasis, this one is trichomoniasis.
But if I may ask,
Okay.
where do you get this sample? In form of fluids or what?
Okay.
Taking a sample.
You're getting a sample.
Yeah.
There are different ways of collecting samples. There's what we call, once you've inserted your speculum
Yes.
into the vaginal canal, you'll do what is known as high swab.
I swab.
High swab. You take the sample from the cervix. You can take another sample in the water in the vaginal canal. Okay. Now, we were talking about the bacterial vaginosis. With the bacterial vaginosis, we've talked about the acidity part. So if you dip in the acid, if you do the urinalysis, you take the sample of the urine, then that urine stick, you will dip inside there. If the pH is more than 4.5, then we'll make a diagnosis of bacterial vaginosis.
Why not 5.5?
Okay, we have this is a scientific thing that has been done. Now, commonly the bacterial vaginosis, it has been analyzed that it thrives in the acidic part of more than 4.5.
So it cannot go beyond.
Yeah. Okay. Have you seen that? Yeah. With the candidiasis, is less than. If you take that particular dipstick, then you dip it in the urine, it is going to be less than 4.5. Have you understand that? But
Meaning if it can go to 5 point something, that person is abnormal.
5.
Let's say 5.6 onwards.
Now,
the abnormality.
Now you must know now what are you targeting. For example, we've talked over bacterial vaginosis. I've said the pH is 4. It's more than 4.5. So more than 4.5 will make a diagnosis, but not alkaline. You know the alkaline, it starts from, do you know the pH value?
Yes,
the pH number line. So you're in a position of knowing the acidity and alkaline part. Have you seen that? So anything more than 4.5, that is bacterial vaginosis. Because you must remember, we talked of this bacteria thrives well in an acidic condition. So if the acid is more, it's not going to grow or multiply very well.
Because of the nature.
Because of the nature and the environment of this particular particular pH value. Right. You see that? And there's trichomoniasis. Trichomoniasis, I told you that this patient will come and complain of very intense itching.
Serious itching.
Yeah, very serious itching. Have you seen that? You know, the woman can come and complain of itching until she cannot sleep. Have you seen that? Now, and if you ask the color of the discharge, it's always green. Green in color. And again, she'll complain of this particular discharge. It's water. It's false in smelling. Very bad. Not some of smell. False smell is smelling. Have you seen that? And of course, there will be when she's urinating, she's feeling pain. There's urea. Painful urination. Have you seen that? So such kind of the history taken will lead you to a diagnosis by the name trichomoniasis. Okay? So those are some of the few investigations that you do and are able to come up with the diagnosis and help this particular patient. Now, treating such condition is simple once you've come up with the diagnosis.
When you have no.
If you've not come up with the diagnosis, now what are you going to treat, by the way? Nothing. You will not be in a position of helping people. She will be moving from one hospital to another. Now, when you're treating the vaginitis,
Yes.
The vaginitis, we use metronidazole. Metronidazole, in a layman's language, it's a fragile. Yeah.
I know fragile. We treat stomach only.
Okay. But you know, those are the organisms that actually, you know, it's from the mouth to the anus. So these organisms move. Okay, that is what we have been knowing. Yeah. But fragile is an antibiotic which does a lot of things. Then you combine with the other antifungal by the name fluconazole. Then you'll have been good to go. Right. But we must take into consideration that for pregnant women, when you're treating a pregnant woman, there are some suppositories that are used. So in the first trimester, you're not supposed to give a metronidazole, because this one is going to affect the growing fetus. So metronidazole and fluconazole, those are contraindicated. You're not supposed even to go to the chemist and ask about that, simply because doctors have said. So in the first trimester, that one is not allowed. And please don't diagnose yourself and treat just because you've had the doctor saying that you buy this and this. Go to a doctor nearby you and he will be in a position of helping you. Okay? So to pregnant women, the metronidazole and fluconazole, those are contraindicated. You're not supposed to give those in a pregnant woman. Yeah. And fluconazole is contraindicated.
Meaning when you give will affect the fetus.
Yeah. Instead, you can use metronidazole suppositories. They are drugs that they are being inserted inside the vagina, and even the clotrimazole pessaries. That one you can do much better. Right. When you come to treatment of the cervix, that is the cervicitis, you can use ceftriaxone, using together with cefixime. That one you again does best. You can combine with azithromycin. Then that particular patient will be good to go. Now, having seen that, some of the complications of these diseases, and the most common complication is actually infertility to most of the women. Because you see that once this disease have ascended beyond the cervix, it's going to cause what is known as the PID, Pelvic Inflammatory Disease. PID.
In short, PID.
The PID. Okay. Now, you find that the fallopian tubes are going to be affected. Listen that even the ovaries are going to be affected. So getting pregnancy, even if you had a baby earlier before, you'll get what is known as secondary infertility. Okay? Knowing that, so it's good to know, and once there is something which is abnormal, the discharge that I've talked about, as in you see that it's abnormal, go to your nearby clinic and you'll be diagnosed and be treated very well. Having seen that, now I want to thank all of the Silverton media for coming to our facility, and I would like to say that this is a facility which helps most of our women. You can come at any time so that we can treat our girls, our mothers, because those are the ones which are being affected most. And again, I would like to say that for the general viewer, if you can assist our facility by buying those complicated facilities, equipment, you can come along so that we can help our girls and our mothers. Having said that, thank you very much. You can mostly find me in the phone number 07 16 00 35 64. I can also, you can get me from in the WhatsApp, Dr. Mohabe Noah. Yeah, those are the most of the social media that I'm being found at. Right. Otherwise, thank you very much and be blessed.
So before we end that time, remember that this is a Flamingo Mission Hospital. Why don't you tell the viewers where it has been located and what are you normally been doing here, so that they will understand. And those who, many women will visit here and they want to know how will you treat, which type of medication will you give them now.
Okay, thank you very much. Let me rectify, it's not Flamingo Hospital, it's Eagles Mission Medical Health Care. We are in Spine Road, in between step 1, opposite Komarok Secondary School. That is where you will find us. And again, I've given out my number as 07 16 00 35 64. Once you are in step 1, Kayole will be in a position of communicating and will be directed accordingly.
Yes, Madam Daktari, you see this Eagle Mission Hospital, which is private. Now, why are you here in a private? Why would you go there, which you are saying here? It has been located in step 1. What brings you here, being private Mission Hospital?
Actually, here we are in step 1, so this is a sub-branch. But if we find that your case is complicated, we'll take you to our main facility for further investigation, and we'll be in a position of helping you more.
Is there a disease that you can cure here? apart from that one for genital discharge?
Okay, the work of a doctor is not to treat only one disease, because we are trained to do a scope of diseases. I'm also medical. Okay, we do operate, we do scissors, and a lot of things. It's not the only condition that we can treat. Yeah, so a doctor can do a lot of things depending with the area of specialty. Yeah.
Okay. You are here. What are the challenges facing you here? Maybe in any way, difficulties when you are here.
Okay, some of the challenges that we are facing, one is financial muscle to expand our facility, because you find that there are other investigation that we would like to do to most of our patients, but unfortunately we have to refer them to other big facilities. But it must be known that even referring is part of management. Yeah.
Now I want to give you this opportunity to market this Eagle Mission Hospital.
So Eagle's Mission Hospital is a hospital which cares for patients, and we value our trustfulness, and we are not interested much with money. As long as you come, we'll be in a position of helping you according to what you have. Now come and experience the best out of the training, the trained personnel that they are in our facility. Thank you.
Thank you very much, Dr. Noah. Now we don't have much to say. This is Celebraton Television, which is changing life to be lively. Remember that we have our station in Mwiki, Kasarani, that if you want to follow us live, go to visit to our Facebook page, which is Celebraton Television, where you can get us, and we will give you what we have there. Thank you very much.
Specializes in music production, video production, movie production, film classes, that is acting, script writing, and film directing. They also offer music school, computer college, and school of journalism. They also do online marketing, that is advertising items and properties online. You can reach them via their phone number, that is 0741 280 262. And you can reach them via another phone number, that is 0731 225 738. You can also reach them via their email address, that is silvertonmediamanagement@gmail.com.